as you'll be aware that soon after that, the following week, it was the State of the Nation address. And as they say, the rest is history. There were many other events. But however, over the last 4 weeks, we have been in touch, keeping in touch with the public through various platforms of communication, making announcements, including on changes with the vaccination program, which we will speak to later this morning. Dr. Chris will give a lot more on the changes with the boosters and the schedules. Now, all that we're doing is to make sure that the vaccination is accessible, to protect the lives, and also to open up economic and social life. The COVID-19 pandemic continues to ravage the world, the entire globe, and our own country. Over the last 7 days, the World Health Organization reported that there were more than 10 million new cases in a week in the world, with more than 60,000 deaths in a week. And that really shows us that the virus is still, ravaging the world. The Omicron variant remained dominant, with 99.5% of the tested specimen which have been sequenced showing the Omicron variant. In South Africa, in the last week, we have seen a 20% reduction in new cases from an average of 16,000 cases per week to an average of 12,800 per week. The Gauteng province is still leading at an average of 38.4% of the new cases per week, and also per day, almost the same average percentage for Gauteng, followed by the Western Cape at the 20% positivity, no, 20% of the positive cases on a weekly basis, and followed by KZN at 15.5% of all the positive cases in a week, and on average also per day. In the past week, all provinces have reported a decline in weekly incident risks, except for KZN, which showed no change in the risk incidence. The percentage testing positive in the last week was highest in the Mpumalanga province at 14%, followed by the Western Cape at 12.6% positivity, and Northwest was the third at 10.5%, while all the other 6 provinces were having a less than 10% positivity rate. The percentage positive was highest in the age group 10 to 14 years of age, which was on average 21% positive in this age cohort, which is obviously worrying that it means that we're getting more positivity, more positive cases at the younger age group of 10 to 14 years. We did say last time that this was possibly because of school opening, but it looks like the trend has persisted. The dominant variant in South Africa also remains the Omicron, although there is also a sub-variant of the Omicron called BA.2, which is currently accounting for 78% of the infections in January and February. But the characteristics are not, it still remains the Omicron, although with a sub-variant, which has been dominating amongst the young people. Currently, there are 25,758 active cases, which is an increase of 1.3% over the last 24 hours, which again shows that we're not declining at a rate at which we would have wished. In terms of districts, increases has been recorded in the Overberg district in the Western Cape, the city of Cape Town, the Francis Baard district in the Northern Cape, and also in the west coast of the Western Cape. 12 out of 52 districts have recorded increases in the last 14 days compared to 14 days earlier. Admissions in hospital as of yesterday stood at 2,602, which is an 8% decline over the last 24 hours. Over the last 7 days, there has been an 11% decline in hospital admissions. Now, very important is the confirmation again that 72% of the admissions are those of unvaccinated people. 83% of the admissions are in general wards, while 7.4% are in high care, and just under 10%, 9.6% are in ICU. So in absolute numbers, those who are treated in the ICUs are just under 250, 248 as of yesterday. Deaths in hospital have also reduced by 28%, which is good, although we would have wished that nobody should still be dying from the COVID. The total fatalities as of yesterday stood just under 99,500, just I think two less than this, 99,500, with a recovery rate of 96.6%. Our major disappointment is that the rate of infections have not declined as steadily as we had wished for, that by this time we had to hope that by the time we reach the end of February, we would be at less than 5% positivity. We have seen recurring spikes in various districts, as I've indicated, 12 out of 52, which is leading to a plateau in the curve of infections instead of a complete flattening and decline to what we had hoped for. This has resulted in the last 4 weeks a plateau, which led to a positivity rate continue to linger between 7 and 10% over this last 4 weeks. As of yesterday, the positivity rate was at 7%. We're hoping to see more sustained decline, which will result in the positivity going below 5% in the next few days, and not, hopefully not weeks, but days, which will signal that the pandemic will again be under control. On the vaccination front, the vaccination continues to move steadily, but not at the kind of pace which we were hoping for. After remaining between 60 to 70,000 doses per day on weekdays over most of January and February, there has been a slight pickup over the last 7 days, seeing us going over 100,000 doses over the last 2 days, after a steady rise over some days, reaching 80,000, 90,000, and then over the last 3 days, we were able to surpass 100,000 doses in a day. As of yesterday evening, when the vaccination stations closed, the total doses administered stood at 31,879,000, which had been administered to just over 19 million adult individuals, constituting just under 48%, 47.95% to be accurate, coverage of the adult population with at least one jab. In terms of gender, out of this, 56.5% coverage is for women, while men stand less than about over 10% less of coverage at just 43.5% for the men. Individual adults fully vaccinated are just over 17 million at 43%. We hope to be able to pass the 48% in the next few days, which is nevertheless still a very far cry from the 70% coverage which we require for population immunity. Now, this will, if we were to reach the 70% coverage, this will make us able to, open up a lot more activities and also reduce the need for a lot of the health measures. If many countries which have now reached 70 to 80% are able to do without many of the health protective measures. We are very pleased with the 70 plus age group cohort as the best performers, currently standing at 68% of vaccination coverage. The 50 to 59 standing at 64%. So overall, the over 50s have done well, and not yet at 70% coverage, but standing at 60% of full vaccination. The Free State province is still the leading province at 57.2% of vaccination coverage. And the other provinces, Western Cape follow, and then Limpopo and Eastern Cape also above 50%, the others at just over 45%. In terms of absolute numbers of vaccination, Gauteng is leading by far with more than just under 9 million doses administered, standing at 8.9 million, with just over 5 million people who have received a jab. Their coverage, nevertheless, stands at 45% due to the large population of Gauteng. Our biggest drawback remains the young people 18 to 34, who are only at 34% coverage, with only 29.3% full vaccination. We need at least 5 million more of this age group so that they could be pushed their coverage to at least 60%, which will also push the national coverage also to closer to at least 60%. We hope that the initiative by young people to drive the vaccination campaign of their own peers, which was launched just under 2 weeks ago, will bear fruit. The total doses which have been administered to the younger people, school-going age of 12 to 7, is now just over 1.65 million doses. As I've mentioned, as we have announced earlier, and as I said, Dr. Crisp will speak more to that, we have made some changes so that which entail that the time frames for the second doses of Pfizer and the boosters for both Pfizer and Johnson & Johnson have been brought closer due to the available capacity and also the need to protect those who want to be protected. And we'll speak to this at a later stage in more detail. As I mentioned earlier, the young people have taken the step to mobilize their peers to take up more vaccination under the theme, Ready, meaning I'm ready. The campaign is led by young health professionals, and ours as the Department of Health is just to give them the support. They are otherwise in charge of, fully in charge of this campaign, and we hope that it will make a lot of difference. The issue of vaccination mandates remains a difficult topic in our midst in the population. A team of senior government officials have been leading consultations with various stakeholders, including at NATLAC, and they should be ready to report to the next National Coronavirus Command Council with recommendations. While there are different views on this matter, the undisputed fact is that the more people vaccinate, the more we can open up the economy and more social activities, more sporting activities, more recreational activities, and there can be more social interaction as well. As I've mentioned earlier, countries which have reached up to some of the countries which have reached up to 70 to 90% coverage are now able to do without many of the health measures. During his SONA speech, President Ramaphosa stated that government has the intention to do away with the state of disaster as a tool to manage the COVID-19 pandemic. The Department of Health and other departments were given the task to come with other instruments which could be used to provide whatever safety measures will still be required to limit the spread and limit the impact of the pandemic. The Health Department has been hard at work revising its regulations to control notifiable infectious diseases. And the department is currently ready to present to the NCCC with recommendations of new regulations which can take over from the Disaster Management Act. As the World Health Organization stated at various forums, two of which I attended during the course of this week, including yesterday, they've emphasized that COVID-19 is not over. And as can be seen with the numbers which I mentioned, of 10 million new infections in a week and over 60,000 deaths in 1 week globally. And they've stated that we must avoid reversing the hard-earned gains we have made as we strive to end the pandemic. We hope the reviewed health regulations and other regulations from other departments will assist in guiding the reopening on various more economic and social activities, especially in the leisure and tourism areas, or reopening with less risk of super spreaders. The proposals will include amendments to travel requirements, which could make it easier and cheaper to travel into South Africa and out of South Africa. Details will only be available after this proposed new regulations have been presented to the NCCC, hopefully in the coming week. We want to again make a clarion call to all South Africans that COVID-19 can be defeated if we all work together to protect ourselves and also protect those around us with the main tool, which is vaccination. One always feels very envious when participating in various international forums, including one in which I was participating yesterday with the various health ministers from various countries and continents, when you hear them mentioning that they have now reached a coverage of 70 to 90% of their population, which enables them to open up many activities, including sports activities with full attendance. So the future of this country is in our hands. We can reach where the other nations have reached. We have enough stock, enough capacity, which if taken up, can take us up to where these other countries are, so that we can be able to open up, but avoid super spreaders and be able to protect lives and avoid illness and death. We have a few weeks and months to claim our place amongst nations of the world. Beyond this year, it will be very difficult to interact with other nations of the world without vaccination. Let's make sure that we are not left behind. Kinako, it's time, as our young people have said, we should all be ready to take our place on the vaccination queue so that we can be able to have full integration with the rest of the world. Thank you very much.
Thanks very much, Minister, for that update as far as vaccination is concerned. Indeed, the fact that the pandemic is under control does not mean we must lower our guard. The struggle continues. The fact that we continue to report at least a few number of deaths every day, it means we are still in trouble. So we must continue to vaccinate in numbers in order to be integrated with the rest. So without wasting any time, I'm going to call upon our colleagues from NSCD who are going to provide us with the epidemiological report as far as the vaccination is concerned. Over to you, Dr. Michelle and Dr. Wasila Jasat.
Good morning, everyone, Honourable Minister, Deputy Minister, colleagues and members of the media. So just a global update, just in terms of where we are with the global pandemic. You can see we had globally, there was a very large spike in infections in the recent months, which were driven by the Omicron variant. But in all regions, the number of cases of infections are coming down. And here you can see just in terms of deaths, at the top is infection. So you can see that big spike, whereas in deaths, we really are seeing deaths which were much lower than we're seeing with previous waves globally. In South Africa, just over 3.6 million cases. We continue to see a week-on-week decrease in the number of new cases detected. So the tail end has been, the decrease has been slower than what we've seen in previous waves. So we had this very rapid rise with, when the Omicron variant took hold, a decrease, and we have had this lingering tail of infections. And I think just important to note that although we're not seeing the same kind of quick fall off of the wave as we've seen previously, is that we're in a very different point in the pandemic, and we have been decreasing the restrictions. And in line with that, I think it's not unexpected that we would still see infections. And I think the metric really, as you'll see the presentation by Dr. Jasat, I think it's important to be monitoring the hospitalizations and deaths. And I think we've been seeing continuous decreases in that. And so I think although there is this low level kind of plateauing of infections, it is coming down slowly, and I think really needs to be interpreted in light of the opening up of the economy and the decrease in the number of restrictions. Also, I think we have very high underlying immune protection, either through natural infection or through vaccination or through a combination of both of these. And I think we're seeing this protection against severe disease. Just in terms of the Omicron variant, so since December, this has been the dominant variant. We have seen the rise of the sublineage, which is the BA.2, which is now making up the larger proportion of our sequences. Just to bear in mind as well, because the case numbers are very low at the moment, the number of sequences are also very low, and the quality of the sequences also tends to be lower because we're not seeing high transmission rates. And so although there has been some data from overseas showing there may be a slight increase in transmissibility of the BA.2, studies from South Africa have shown that there's no difference in the severity. So we have not seen any increase in severity with this subvariant. Also just showing, the trends over time. In the dark orange is the BA.2 and how we've seen this rapid increase in this lineage, but we're not seeing, as this sublineage is increasing, we're not seeing the same increase. This is the percent testing positive. We're not seeing, an increase in percent positivity in line with that new variant. Just in terms of weekly incidents, so all the provinces are coming down, stabilization in some, like KZN, which reported no change. And so we really are seeing the slow decrease in all of the provinces and nationally. Just in terms of age distributions, our highest incidence is still in our oldest population, the over 80s, and the lowest incidence in the younger populations. And we're seeing decreases in all of these age groups. You can see there was this increase in the under 20-year-olds in the school, particularly the school-going age groups. When schools opened, we had this slight second little blip in terms of those school-going age groups, or the under 20s. I think at that time we also opened up the schools to full capacity and all schools were back. We did away with the rotational schooling, and I think that may have been responsible for that. We've also seen the universities returning, and so I think that is still responsible for these small increases that we did see, particularly in the under 20s, but all age groups are now decreasing. In terms of our testing, our positivity rate is slowly coming down, and I think in this past week was the first time that we've come down below 10% since the fourth wave. So although the decrease is not as rapid as we saw after the third wave, we are coming down in terms of the positivity rates. And as I'd said, in terms of case incidents, I think really just have to bear in mind that we're in a different point in the pandemic. There may be different access to testing or willingness for people to go for testing, especially if they've previously had infection and been vaccinated. And so I think we do need to interpret this in light of the current state of where we are. In terms of percent positivity, we are seeing decreases in most of the provinces, unchanged in some of them, a very small increase in KZN, but really this is kind of negligible, just a 0.4 increase. Still highest in Mpumalanga, this is coming down, followed by Limpopo, but also seeing decreases. And you can really see the return to the kind of lighter blue and green colorations of the low positivity rates. So all the other provinces have dipped below 10%. Just in terms of the age, I think this is really just showing that most of the increases that we've seen in infections in the last weeks, kind of from mid-January and really coincided with the children returning to school, has been in these younger age groups, so the 10 to 14-year-olds, 15 to 19-year-olds, and to a lesser degree, the 5 to 9-year-olds. And so while we did see that peak, this was really associated with the back to school because it was a week to 2 weeks after the schools went back. A little bit of a blip, I think, which was responsible for universities and also changes in the regulations at schools, opening up of all the schools. But in the past week, we are seeing decreases in all of these age groups. So I think just to summarize, Omicron is still the dominant variant. BA2 has increased from 5% in December to 36% in Jan and is now the dominant subvariant. I think just to note that we are continuing to monitor through our sequencing in terms of detecting any new sublineages or any new variants of concern. Nationally, we continue to see decreases in the daily new cases, the weekly incidence and number of tests, and we're seeing for the first time in this wave a decrease to less than 10% positivity overall at a national level. And we're seeing even in these age groups where we have seen the higher positivity rates in the last couple of weeks, decreases in those age groups as well. In terms of the provinces, all provinces are seeing decreases in weekly incidence or stabilization, where KZN was unchanged. Percent positivity, either seeing decreases unchanged or very small changes like in KZN with a 0.4%. And I'll just hand over to Dr. Jasat just to lead you through the hospitalization data.
Good morning to Honourable Minister and all our colleagues and all the media that have joined. Today, I will take you through some of the hospital data available on DATCO, but just provide a little bit of some of the other epidemiological analysis we've been doing. So many of you may not know, but I just thought I'd start off by saying that DATCO was developed now 2 years ago as a hospital surveillance system and covers all hospitals in the country. But we also expanded a platform to allow for other modules. So we have a module where we monitor COVID-19 cases in long-term care facilities, in care homes, and we do surveillance there. We worked with the MRC and some of our pediatric colleagues around the country to develop a pediatric registry on DATCO so that they can collect more detailed information on children who are admitted. We introduced a module on community deaths because, of course, DATCO collects all the in-hospital admissions and deaths, but we didn't have a place to consistently and in a standardized way report out of hospital deaths. And so we now have a module, and all provinces are now using that to report their out of hospital deaths as well. We also are in the process of linking our data with the EBDS and, are able to look at questions around vaccine breakthrough, vaccine effectiveness, and hopefully, with the Department of Health, we'll soon start reporting on that. We also have a module on bed occupancy. So instead of just reporting on patient level data, hospitals are able to report on the number of patients admitted in high care, standard care, and ICU, and we can look at bed occupancy across the country during the waves. And finally, DATGov at NICD, we also have a study on long COVID where we've been following up patients and will follow them up for up to a year to describe the prevalence and risk factors for long COVID. So DATGov currently receives data from 407 public hospitals and 259 private hospitals around the country, which represents all the hospitals who have treated patients with COVID-19. To date, 506,000 admissions have been reported, with the highest numbers in Gauteng and Western Cape, and just over 100,000 deaths have been reported to DATGov, with the highest numbers being in Gauteng, Western Cape, and KZN. However, the incidence risk of admissions was, once you take into account the population numbers, was highest in Western Cape, Free State, and Gauteng, and the highest incidence risk of COVID-19 deaths in hospital was in Free State, Eastern Cape, Western Cape, and Gauteng. So on the left, you can see the numbers of admission by public and private sector across all 4 waves. And you can see particularly in the second and last wave, more admissions occurred in the public sector, but generally similar numbers. In total, 276,000 admissions have occurred in the public sector and 229,000 in the private sector. On the right, you can see the incidence risk of hospital admissions by province. And you can see that, in all waves, Western Cape, Gauteng, KZN seem to be most affected. This is the number of COVID-19 in-hospital deaths by sector on the left. And you can see that in each wave, more deaths occurred in the public sector than the private sector. And in total, 61,936 deaths were reported by the public sector and 39,111 by the private sector. On the right, you can see the incidence risk of COVID-19 deaths in hospital by province. What you can appreciate is that the incidence risk was highest in the second and third waves, and that the provinces that had the higher incidence risks were Western Cape, Gauteng, KwaZulu-Natal, and Eastern Cape. So this is just comparing the daily average of admissions and deaths in the current 2 weeks and the previous 2 weeks before that. And you can see that in all provinces, there's been a decrease in hospital admissions and a decrease in deaths that were reported from hospital. So this continues the downward trajectory of hospitalizations in the 4th wave. And we've now reached low numbers similar to the interwave periods previously. I just wanted to share some data with you on looking at admissions and deaths by age group. On the left, you can see the number of COVID-19 admissions by age group. In the first, second, and third waves, most admissions were in 50 to 59, 60 to 69, and 40 to 49. So sort of those middle age groups, 40 to about 70. In the fourth wave, however, most admissions were in the 30 to 39 and the 20 to 29 age group. So certainly a shift in the fourth wave towards more admissions in younger people. And I know a lot has been said about, the increased admissions in the pediatric population, but on the right, just to give some perspective, when you compare admissions in children 0 to 9 and 10 to 19 with adults over 20 in terms of the number of admissions, you can see that children make up a very small proportion of the overall admissions. And in fact, there were 31,797 admissions in children throughout the pandemic, which represents 6.3% of all admissions that have occurred. So that was a number of admissions. When you look at the incidence, which is the number of admissions over the population numbers, what's quite clear on the left is that the incidence of admissions increases with age. And so the highest incidence is amongst the over 60s, and of course it decreases with the decreasing age group. And that was true across all age groups. On the right, you can see just the pediatric population. And what was quite evident was that we had a higher incidence of admissions in the third wave, as has been reported before, and then an even higher incidence of admission in the fourth wave, particularly in very young children under 5. These are the number of deaths in hospital by age group in Epidemiological week again. And again, you can see that most deaths occurred in the oldest age groups. But again, when you compare over 20s and children, children make up a very small proportion of deaths, only 0.8%. So only 827 deaths have been reported in children under 20 of all deaths, which is less than 1%. And again, when you look at the incidence risk of deaths, it's high increases with age. It's much higher in those over 60 compared to any other age group. And amongst children, the incidence risk is quite low and sort of higher amongst children under 5 than other age groups amongst children. So just some data around the patients admitted with COVID-19 and their comorbidities and risk factors for mortality. Amongst patients who we did have data on comorbidities, the most common comorbidity was hypertension, 26% of all admissions, diabetes, 17% of admissions, and HIV at 6% of admissions. TB was reported in about 6,000 patients, active TB, and previous TB in almost 10,000 patients. When we look at the patients who died and we looked at the percentage of those deaths who reported particular comorbidities across each age group, you can see that hypertension in orange and diabetes in gray are responsible or implicated in most deaths, particularly amongst the older age groups. You can see that a large proportion of the deaths had hypertension and comorbidity and diabetes as comorbidities. But in the younger age groups, the under 20s, the 20 to 39, you can see more patients who had HIV and TB and obesity compared to hypertension and diabetes. So there's a complex sort of interplay of being diagnosed with COVID-19, having underlying comorbidities, and actually having multiple comorbidities, because many of the patients that were admitted had, 2 or more comorbidities. And these obviously contribute to mortality. When we do a multivariate analysis, looking at the risk factors associated with in-hospital COVID mortality, and this is the most recent analysis done in the last week, we know that there's an increased risk for males compared to females in terms of mortality. Risk increases with older age, and that's actually the biggest estimates. So when you look at these are the odds ratios on a log scale, and you can see compared to all the other risk factors, the adjusted odds ratio for age are huge. So the biggest risk factor for COVID mortality is increasing age. Of course, non-white race is associated with increased risk of COVID mortality. Medical conditions such as hypertension, diabetes, chronic cardiac disease, chronic kidney disease, cancer, obesity, TB, and HIV are all associated with risks for COVID mortality. Being admitted in the public sector has a higher risk of mortality compared to the private sector, and being admitted in certain provinces has a higher risk of mortality. But I wanted to focus particularly on the wave period. So we compared patients admitted in wave 1 with those admitted in wave 2, 3, and 4. And as you can see, the adjusted odds ratios here on the right, Compared to wave 1, if you were admitted in wave 2, you had a 50% higher risk of dying. In wave 3, a 30% higher risk of dying. But if you were admitted in wave 4, when Omicron dominated, you had a 50% lower risk of dying. And so, I think what has already been reported in the literature and also in our South African data is that there was a higher risk of dying in the Beta and Delta waves and a lower risk of dying in the Omicron wave. Thank you so much for your time. We're happy to take some questions after.
Thanks very much, Dr. Vasily Lethart and Dr. Michelle Groom from NSFT for that update as far as the epidemiological report is concerned. So without wasting any time, I'm going to hand over to Dr. Chris to provide us with the update as far as the vaccination is concerned. Over to you, Doctor.
Good morning, everybody. Good morning, Foster, Minister, Deputy Minister, DG, and colleagues. While I just find the place to share, here we go. Okay, thanks very much. So I thought what I would do is, first of all, just show where we are now, and then look a little bit, just in a couple of slides, of what has happened since we have made some changes in the vaccination schedule. The Minister referred to this. But I want to start by saying COVID is definitely not over. The Minister made that point earlier, and we can't emphasize it more. COVID still kills people, even if it kills fewer people. It still makes people really sick, even if it puts fewer people in hospital, as we've seen in the figures. So in terms of our vaccination status, we announced a short while ago some changes to the schedule, and there's still one or two more changes coming. So I'll talk you through this slide very briefly. So the options at the moment are that we have a primary schedule of a vaccine. This is the Comirnaty, is the Pfizer vaccine. And now we've reduced it back to the original 21-day interval that we had at the beginning of the vaccination program before you get a second Pfizer, and that's the primary Pfizer schedule. Then what is available at the moment is a 90-day interval, which was going to be 180 days, but this is the evidence in the countries that we've looked at is that from 90 days, there's a very good immune response, and it is perfectly safe. So for persons under the age of 18, we do not provide boosters, but over the age of 18, 90 days after the primary schedule. And now there is what we call heterologous boosting, or boosting with either of the two vaccines. So after the 2 doses of Pfizer, you can either get boosted with a Pfizer or a Janssen, a J&J dose 90 days later. The second option is that you get 1 dose of Johnson & Johnson, and 60 days later, we offer a Johnson & Johnson or a Pfizer dose as a booster. Now, this will also be augmented in the coming days, where some people got 2 doses of Johnson, and we are now going to offer a Pfizer booster after that. That will be announced shortly, and obviously that will be probably taken up the earliest by healthcare workers, since that is the schedule that they were given as part of the Sisonke study. So where are we at the moment? Minister referred to the total number of vaccinations approaching 32 million doses. It's quite interesting to note, although Gauteng's ratio to total population is not the highest, because of the sheer numbers in the province, they are approaching 9 million vaccinations, which is a massive effort, combined effort of private and public sector vaccination program. They're very well on their way to 9 million. But I want to turn attention to the right-hand side of this graph. These are the province's vaccination trends in doses administered per week. And you're very familiar with this, I'm sure. This is on the public dashboard, and you can watch what's happening. So this was the growth in the vaccination program, with the period where we had started to run out of stock. And then we got the donated Pfizer vaccine, and we started settling down into the Johnson & Johnson delivery schedules, and things picked up tremendously. In all provinces, the pattern is the same, except, of course, KwaZulu-Natal during the violence in July last year. But what has happened now, since January, is in December, when we were all sort of burnt out and tired, and we were struggling with Omicron and really wanting to get a break, we had this huge decrease, very worrying decrease in vaccination. But it has picked up substantially in the last couple of weeks. And with the changes to the schedule and the access to vaccinations, we are seeing in all provinces quite a nice pickup in the number of vaccinations that are taking place. But where are the gaps? So we've got 19 million individuals vaccinated. So that's this is, excludes the children, the 1 million below the age of 18. But 19 million adults are vaccinated with at least one dose of Johnson & Johnson or 2 doses of Pfizer. And this is where we need to increase our numbers. Although the population between the ages of 18 and 49 are large numbers vaccinated, as a percentage of the total population in those age groups, we're still quite a long way to go to get a really good coverage like the 70% that we are striving for across the whole country. So this is why you will have seen the efforts that are being put in the public space is to get hold of younger people, especially the 18 to 34. They started vaccinating long after the older population, so there's a lot of a time lag to catch up, and especially with the male population in these two groups lagging behind the female population. Here you can see we are now looking at individuals vaccinated to see what is happening, who is coming for vaccination at the moment. And this is the concerning trend, is that in the last month and a half, we are seeing a fewer number of new people coming for vaccination. So although we're still getting larger number of vaccinations, this trend tells us that it is people returning who have previously been vaccinated, and the total number of new people who are being vaccinated is relatively small. That means we are not getting our herd immunity from vaccination or our boosting from vaccination up fast enough. You can see this on the public dashboard, where it shows that these 19 million adults constitute 47.9% of the adult population. And as the minister indicated, there are 4 provinces now that are above 50%. And that's very encouraging because there are large population provinces included in this, like the Western Cape and Limpopo and the Eastern Cape. And then Free State's a slightly smaller population, but they're doing extremely well, approaching 60% of the adult population now vaccinated. I also want to emphasize this because it's come out in the 2 previous presentations and in what the minister said in his introductory comments. And this is who is ending up in hospital and are they vaccinated or not vaccinated. So I've chosen just one slide. If you go to the public dashboard, you can filter and look at using these tabs on the left-hand side. You can select what you want to look at by province or by age group and look at different analyses. And it will give you a very quick picture like this picture on the right-hand side. This, what I've got here is the whole country. And looking at the whole country, first of all, you can see male and female admissions, and the green is those who have been vaccinated. The orange is they have only partially been vaccinated, and the red is the unvaccinated people in hospital. And there's a small group unknown. They didn't declare the either male or female in the records. In the age group, age bands, you saw that relatively small number of 12 to 17-year-olds are admitted, and that was shown very clearly by Wasila a moment ago. But this is the concern, is in the 18 to 34-year-olds, it's such a huge proportion of this population that is hospitalized is unvaccinated. So out of 590, 510 are unvaccinated. In the older population, where you expect people to have, as we've seen, more comorbidities, more chronic diseases, there is a larger number of people where there is, let's call it immune escape. They've been vaccinated, but they still got sick with COVID. So this is the population we really need to concentrate on now to protect. From a health perspective, obviously, we're interested in everybody, and we need to protect older people as well. So what has changed, and has the change in our schedule made any difference at all? So here I'm just looking at a couple of slides comparing the 16th of February with the 2nd of March to see what has happened. In all provinces, there's been a difference in both the public and the private sector, quite a significant positive uptake of vaccinations, 46%, 57%, and so on. These are the percentage growth over that period, comparing a 24-hour period on the same day of the week. And in the private sector, one saw massive growth in the Eastern Cape, KwaZulu-Natal, and Limpopo. And in the Western Cape public sector sites, we saw a growth of 66% in the vaccinations. So this is a very encouraging. So in these figures, you can just see the overall, the actual numbers that were on each of those days with the differences. So in terms of geography, what changes have we seen in that same period? Well, in Mpumalanga, which is the province we've been concerned about lagging behind, everybody's aware we've been at some 42% of the total population vaccinated. We saw the largest change, 1.7% pickup in the vaccination tempo. But very encouraging is Gauteng. There's been a huge effort in Gauteng, both in the public and the private sector, to increase the number of vaccinations. And Free State continues to do well with their program. Also encouraging is a larger number of males are coming, with a 20% increase in that period. And in the age group that has picked up the fastest is the 18 to 34-year-olds. So these have been our geographical, gender, and age targets, and all of them have responded positively in this period of the last couple of weeks. Thank you very much.
Thanks very much, Dr. Nicholas Chris, for that update as far as the vaccination is concerned. We are doing well in terms of time, and we've got received about very few questions. I'm going to read out all the questions before and allow the panel, Minister, Deputy, and the panelists to respond while waiting for the second batch of follow-up questions. The first batch of questions read as follows. When will the healthcare workers be given opportunity to get Pfizer booster after the second J&J dose? The evidence doesn't allow the healthcare workers to get the second dose either from J&J or Pfizer, which is a heterologous booster, as Dr. Chris announced this. The second question, can you elaborate on why asymptomatic COVID-19 infected staff at health facilities and care homes should stay away from workplace for 5 days from the date of the test? Majority of these workers cannot work from home, and this regulation continues to add pressure on the healthcare system. Third question, what amount of vaccines does South Africa have currently? Does the country expect to use those stocks, and will there be some risk of this vaccine being destroyed? And if so, how much? The fourth question, when will our population access the whole virus vaccine? Perhaps some hesitant people will trust this more natural vaccines. I don't understand this question, but if the panelists will understand it better, they can assist to unpack it. Question number 5, good morning, Minister. The US drug maker J&J has announced last month that it's going to close a vaccine licensing deal with South African group, a company called Aspen Pharmacare. Will you have any new information regarding these discussions? Last question, SABC has authorized access or the use of COVID-19 pill in the country. When will the government? When is the government going to roll out this pill? This is the first batch of questions, Minister, Deputy Minister, and members of the panel. I'm going to hand over to Minister to lead in disposing to these questions. Over to Minister and members of the panel.
Well, thank you very much, Foster. Just looking at the questions. Can I ask Dr. Crisp if he could deal with the first one. I think is touched on, but there's, I think, more elaboration required. On the second one, on asymptomatic COVID-infected staff having to stay away from work for 5 days, Dr. Buthelezi, if maybe you could be thinking about that one. I will take 3, the one on vaccine stock, but I'll ask Dr. Crisp to add on that. I'll just do the introductory part of that, number 3. And then number 4, the whole virus vaccine. Yeah, I'm not sure whether we don't have a vaccinology on the platform, but maybe Dr. Crisp could double up as a vaccinologist in terms of the whole vaccine, the whole virus vaccine. And then the number 5 on J&J and Aspen, I think is directed to me. I'll deal with that. The one on the COVID pill, which is approved by SABRA, and between Dr. Crisp and DG Buthelezi, I'm sure they could look at dealing with that. So let me just immediately start on the question number 3. I will not give the actual number of vaccine doses available, but let me just confirm that we do have more than 20 million vaccine doses on stock. Now, at the current moment, we are pleased with the pickup in terms of the vaccinations as reported. There is definitely a risk that at the current moment, there is a risk that just over 100,000 or so doses, which will expire at the end of March, that those may have to be discarded. So there is that possibility. We're looking at that, working around, seeing whether there may be other alternatives, but it does look likely at this stage. In as far as in the medium to long term, 2 things. One, we're hoping that with various efforts, there will be further up, more people coming forward for boosters, for primary doses of vaccination, which it will be a sad day if significant volumes of doses can end up being discarded. We hope that it will not reach that stage. But just in terms of planning what we are looking at, its various strategies through discussion with various partners, including COVAX and other within the WHO family, within other partners within the continent as well. We're working at various possibilities, modalities through which, as we see the rate of uptake, there can be some kind of exchange of vaccine doses through these various platforms, so that if 2 or 3 months ahead of time, we see that a certain number of doses may not be totally utilized within that period, we reach an agreement with some of the partners, so where they're having a more faster uptake, so that they can take our doses, and then at the time when we are ready for additional for return of those doses, then we can get a return of those. So there's exchange program which is being discussed with various partners, so that we could be able to plan ahead of time, so that we can be able to save those vaccine doses. And as time goes on, as more people come forward, we can be able to utilize them. So the risk is there. Unfortunately, there's definitely a risk But we're hoping that as more and more partners in terms of the demand generation, as we mentioned earlier on, 2 weeks ago, we had the young people who are taking forward their own campaign to encourage their peers, as indicated that the 18 to 34, if you include also the 35 to 49, there's still a big possibility of uptake in that cohort. So there are all those kind of interventions which we are working on. The issue of Aspen and Johnson & Johnson, the details can only be explained by the two parties, but what we were informed by Aspen is the fact that they had reached an agreement with Johnson & Johnson. As you know, currently, Aspen has a contract with Johnson & Johnson where they are doing the filling and finishing of the Johnson & Johnson vaccine. Just the end part of the production of the vaccine, what is called filling and finishing.
Minister of Health, Dr. Joe Phaahla, briefing the media about the latest regarding COVID-19 and what the government is doing in fighting the pandemic. Well, we have come to the end of the program. Thank you so much for spending the last couple of